You've probably been there, right? The doctor says, we need to get a better look inside and orders a scan. It happens all the time. But then you hear the words, X-ray or CT scan. I mean, they sound pretty similar, and they both use radiation, but they are so different. So let's dive in and really unpack what sets these two amazing tools apart.
So, what is the real difference? It's a great question because once you get it, you really understand why your doctor might choose one over the other. And here's a hint, it's not about one being just plain better. It's about a doctor choosing the absolute perfect tool to solve a very specific medical mystery. So, first up, let's talk about the original, the X-ray. For more than a century, this has been the go-to, the foundational tool. It was our first real way to peek under the skin without making a single cut. Pretty incredible when you think about it. At its heart, an X-ray is beautifully simple. A machine passes a little bit of radiation through your body, and that creates a two-dimensional image on the other side. Just think of it like a snapshot, a single, flat picture. A good way to think about it is like a shadow puppet. Everything inside your body is projected onto one flat surface. And that's why it's so good for spotting something straightforward, like a crack in a bone. You look at these classic images of a hand or a foot, and you get a great general overview. But see how all the internal parts are kind of layered on top of each other? All right, now let's talk about how that simple snapshot evolves into something way more complex, the CT scan. And it's not a replacement for the X-ray. It's more like a powerful evolution. Think of it like going from a regular, flat photograph to a fully explorable 3D model. A CT scan, which stands for computed tomography, also uses radiation, but it does it in a much, much smarter way. Instead of one snapshot, it takes a whole series of X-ray images from all these different angles. Then a powerful computer stitches them all together to create these incredibly detailed 3D cross-sectional images. Now, that term cross-sectional is the key. Imagine you have a loaf of bread. An X-ray shows you the whole loaf from the side. But a CT scan? That lets you look at each individual slice, one by one. This view is just incredible. It lets doctors pinpoint the exact location of everything, with absolutely nothing overlapping. So the biggest takeaway here is this. A CT scan is just fundamentally more detailed than a regular X-ray. Period. And it's that crazy level of detail that gives it a whole different set of diagnostic superpowers.
So you might be thinking, well, if one is so much more detailed, why don't we just use it all the time? Good question. But it's not that simple. Doctors have to weigh a bunch of different factors to pick the right tool for the job. So let's put them head to head and see how they stack up. Okay, this table really lays it all out. X-rays, they're your go-to for a quick first look. You think you broke your arm? You get an X-ray. A routine chest check? X-ray. They're fast, they're cost-effective, and they use less radiation, which is a really big deal, especially for infants. Now, CT scans, they're the specialists. They're called in for the heavy lifting, diagnosing really complex trauma, hunting for tumors, or mapping out every little detail before a big surgery. The outcome isn't just a picture. It's a detailed roadmap that leads to a much more precise diagnosis. Okay, talking about it is one thing, but seeing is believing, right? Let's look at a few real-world cases side by side. This is where the difference between a 2D snapshot and a 3D model really hits home. All right, have a look. On the left, you've got a standard chest X-ray. It gives you a pretty solid overview of the lungs for sure. But now, look at the CT scan slice on the right. Wow. The difference is just incredible, isn't it? All of a sudden, you can see all the tiny, intricate structures inside the lung tissue itself. It's like the difference between looking at a map of an entire country and then zooming into a detailed street view of one city. Now this is a perfect example. We've got a shoulder injury. The X-ray on the top left, yeah, it confirms there's a problem, but the 3D model from the CT scan, that is a total game changer. You can see the exact shape of the fracture, how the bones have moved. You can see it from every single angle. For a surgeon who's planning a tricky repair, that level of detail is absolutely crucial. Or how about this case with kidney stones? The X-ray on the left clearly shows, yep, they're there, but it also raises a bunch of questions. Where are they exactly? Are they causing a blockage somewhere? The CT scan on the right answers all of that. Bam! It shows the stones in their exact location, giving doctors the critical info they need to plan the best possible treatment. So, after seeing all of that, what are the most important things for you as a patient to remember? Let's boil it all down to the absolute essentials. Okay, let's break it down one last time. An X-ray is your fast, efficient 2D snapshot. It's perfect for that first look.
The CT scan is your 3D detective, the one you bring in when the mystery is deep and every single detail matters. But the most important thing to remember is that neither one is better than the other. It's always, always about your doctor choosing the right tool to get the clearest possible answer for you. So, the next time your doctor orders a scan, you'll have a much better idea of the choice they're making. It's not just about getting a picture, it's about asking the right medical question. And, as technology just keeps getting better, you have to wonder, what will the next generation of medical imaging let us